Good evening, good evening. Welcome to BTV Kenya and welcome to Quest for Better Health. This evening we are very much grateful and we thank God because of the opportunity that God has given us to be here at Oasis Health, Migori branch. Remember, my dear viewers, you can follow us on YouTube, that is BTV Kenya. You can follow us on Facebook page, that is Blackman TV Kenya. You can also follow us on X, BTV Kenya, Twitter and TikTok. All those social platforms, we are there. Remember to leave a comment and remember to ask a question. We believe we are here with an expert in this field and he will be able to address the issues that we are about to discuss. Now, this evening, my guest today is Mr. Peter Jombo, who is a chief nurse here at Oasis Health in Migori branch. Now, let me take this opportunity to give Mr. Peter time to introduce himself and to tell us more about him and his background in his area of specialization. Welcome, Mr. Peter.
Thank you so much, Mr. Isaiah, and thank you so much, Blackman TV, for hosting us this evening. So my name, as you just said, my name is Jombo Peter. I work with Oasis Doctors Plaza Migori. I'm the Chief Nursing Officer here. So today I'm here to respond to your concerns.
Thank you so much. It is not just a matter of concern, but it's a matter of also educating our viewers so that they have the right information. Like I stated earlier, remember, today we are discussing about matters to do with health, that is Quest for Better Health. Now, to begin with, we want to talk about issues to general child health. That's what I want us to focus so much, since you are a specialist in this area. And as a medical personnel, you have broad understanding than me. So, and our viewers outside there, I believe the information we're going to give is going to help them. Now, to begin with, what are some of the health concerns you see in children to date?
Thank you, Isaiah. So maybe to begin with, if you allow me, then maybe I take you through what we do as Oasis Doctors Plaza Migori.
Yes.
Because we don't do only pediatric health, but we also do other areas. So in our facility, we do a number of services. We have obstetric services, and this one is we do both inpatient and outpatient. We also do family physician reviews. So we have the physician consultant. We also do orthopedic services. So we have the orthopedic surgeon. We also do mental services. We have psychiatric. We have psychologist. We also offer nutritional services to our clients. We offer also radiology services. We have the radiologist or the radiology consultant. We saw with us. So these are just among other services besides pediatric services which we offer at Oasis Healthcare, Oasis Doctors Plaza Migori. So today we will focus on pediatric health. And to start with the question you asked about the most of the conditions we see. So pediatric generally has so many conditions. And when we talk about pediatric, we talk about from the time the child is born to the time child is 5 years of age. So at this point, child may suffer from different conditions. One of them is burn. These children are prone to burn. Number two is delayed milestone. So in other words, I'm talking about the delayed growth. So a child is, for example, is 2 years old. But if you look at this child, you may think that is 9 months old. So that is a delayed milestone in a child. So, or a child is 2 years old, but is not murmuring, neither is he talking. They don't walk. So there is something wrong with them. Malnutrition is also a major concern in these children, and also mental issues. So, and mental issues in children basically is hyperactive. So you find that a child is so much into something that you wonder, or they withdraw from certain activities completely. So that is also another area of concern when we talk about pediatric health.
Now, on that note, you just mentioned about health issues, that is mental health.
Yes.
Now, let me just get clarification. What signs should parents look for in terms of mental health sickness? What are the signs that a parent should look at, and upon looking at this, we may decide to maybe have a clue that my child somehow is suffering from mental illness?
Mental illness. Thank you so much. So when you have a child and you see the child is hyperactive, there are certain activities that this child does too much. They do it to the extent that it is more than what they are supposed to do, or the child is so dormant in practicing some activities or in doing some activities, then that is the time you start now asking yourself, what is wrong with my child? So maybe the child is suffering from hyperactivity. So it keeps on doing something too much. It destroys things to do with the object. Yes. So at that point, you should seek now the health care for your child.
Now, in a state whereby you've learned this, what advice would you give to parents if the child maybe is the parent is seeing the child is more anxious and the child is depressed? What advice would you give?
So if you notice a child is having all these manifestations, then the first thing you need to do is to monitor this child closely. So this is a child who should not be left alone, because if you leave this child alone, then they may continue with the activities until now they endanger themselves. So this is a child you need to monitor closely as you seek for medical services in a health facility.
Now, in that case, is there a way that nutrition is linked to a child mental health development?
Yes, there is an interlink. When a child is not being fed well, then a child may have delayed in growth. So when there is delayed in growth, then any other vital organ in the body like brain is also delayed. So when your brain is not completely developed, then the likelihood of you suffering from a mental health is very high. Yes, so nutrition plays a very key role in terms of managing mental health in children.
Now, when we began the conversation, you started by saying, if I really got you well, you started by saying it deals with from conception to 5 years old.
Yes, yes.
Now, in many cases, we have parents who have challenges with the immunization of children, and in most cases, you find that the reaction, some parents do not welcome immunization,
yes,
and vaccination.
Yes.
How do you go about such issues, and what are some of the what are the advices you can give to parents when it comes to immunization?
Yes, immunization is very important in child health, and immunization starts from the time the child is born to as old as adult can still be immunized. So when a child is born, we give two vaccines, that is oral polio and BCG. BCG help the child not to contact TB.
So I want the viewers to really understand what is BCG. I believe that's an abbreviation.
Yes.
Yeah.
So BCG is a vaccine which is derived from the person who invented it. It's called basal communal batenguela. So this is a vaccine we give children when they are 0 to 14 days of age. So this vaccine helps them to not to contact tuberculosis when they grow up. The other vaccine is oral polio, which is given against polio. So thereafter, a child is scheduled for more immunization. So there is one they get at 6 weeks, there is one they get at 10 weeks, then 14 weeks, then 6 months. These are for children who are born with the parents who are immunocompromised. Let's say the parent is HIV positive.
Yeah.
So these are, we call them highly exposed infant. So at 6 months, we give them measles vaccine. Then there is another measles we give at 9 months. That is normal routine for those children who are born with parents who are not HIV positive. then we give another vaccine at 18 months. That is another measles. Again, today we are also having immunization against malaria. So malaria is given at 6 months, 7 months, 9 months, and then at 24 months when the child is 2 years old. So immunization is very, very important because it helps the child not to contact a number of diseases, just as I mentioned earlier. Yes.
Now, you've talked about immunization. We have some cases that a child has to be, the child has to be injected severally.
Yes.
Or at a given stage.
Yes, yes.
Now, what happens if a parent maybe started and he skipped one of the process? In such cases, what happens?
When you skip, it is not advisable you skip, but if you do, then we start from where we left. So our role as healthcare givers and at OASIS, we ensure that the child wellness is maintained by getting all the vaccination which the child is supposed to get. Regardless of whether you have missed or not, we will reschedule you so that at the end of it, you shall have completed the one which you're supposed to get.
Now, does it have negative implications? That is, for example, the child needs to get an injection maybe on 6th of a given month.
Yes.
And for that month, the mother does not show up in the hospital, and the following month, the mother does not show up in the hospital. Now, does it have any repercussions?
Not really, it doesn't, but now the subsequent one we will reschedule. So if maybe you missed vaccine for the last 2 months, you didn't receive, and you are to get maybe the second dose. So we will give you the second dose, but now the third dose we will need to give you immediately. So we will have to reschedule you again for maybe after 4 weeks, you come for now the final dose.
Now, OASIS,
yes,
you people have a reputation of good services and quality services that you offer.
Yeah.
Now, for the period that you have been in Migori, the OASIS Doctors Plaza has been in Migori, what are some of the common illnesses in children that you treat frequently, and how can parents manage them?
Number one is malaria in children. It's very common because we are in a low humid area where the mosquito thrives so well. So there is a number of malaria cases here. Number two, we have diarrhea in children. You know, when children, when they're still young, everything is triggered towards the mouth. So they pick anything they put in their mouth. So this one makes them to have a number of infections, which now manifest in them as as diarrhea. So diarrhea is very common. To some extent, we also have malnutrition in children. We also have sickle cell in children, and also burn. So burn comes as a result of, you know, when a child is growing, it reaches a stage now they want to conquer. So they are venturing in everything. So they get hot objects, hot water. They want to, like, what is this thing? So in that process, they get injury. And the most common injury in children is burn. Yes.
Now, we have witnessed a number of cases outside there where you find that a child is sick, or there are symptoms of a child being sick. Like, how should parents, or how can parents differentiate between common cold and something more serious in children's health?
Yeah, so common cold, you will find that the child is having a flaring nose. So there is flaring nose for even more than 2 days. But if it comes with difficulty in breathing, then it is no longer common cold, because now the respiratory system of this child is compromised. So you need to bring the child to the hospital so that we do more assessment, we do more diagnosis, so that we come clear on what we are managing with these children. Because maybe the child may be suffering from pneumonia, and you don't know, you are treating it as common cold. So the best thing you can do when your child is having such symptoms, they have flaring nose, difficulty in breathing, they cry a lot, they don't eat, just bring the child to hospital. At OASIS, we will attend to the child.
Now, I have like about two questions which are about they're kind of intertwined together.
Yes.
So maybe let me separate them. We have witnessed in many cases
Yeah.
parents or caregivers,
Yes.
that is the guardians,
Yes.
a child is perceived to be unwell and they run to the nearest chemist
Yes.
and they buy drugs over the counter. In most cases, they buy like Panadol, and they rush back to the house and they give the child without the doctor's prescription.
Yes.
What is your take on that? What can you say about that?
Yeah, we don't encourage this because once you go to buy the over-counter drug, you're not sure of the diagnosis you're going to manage with this drug. And sometimes you are also not sure with the dose you are going to administer. So this is what has caused what we call the drug resistance in managing a number of conditions in children. Because maybe you're suffering from malaria and you are given something else. So you get now the drug is building in your body, but it is not getting the targeted parasite or the pathogen which is supposed to act on. So we encourage you that if you have a child with any symptoms of fever, convulsion, the child is not eating, just make an attempt and come to Oasis Doctors Plaza Migori, then we will attend to you based on the findings.
But like I said, I have the question is kind of linked to the one that I want to ask you now.
Yeah.
Now, I've witnessed a case whereby a lady took the child to the hospital.
Yes.
The child is diagnosed with malaria.
Yes.
I hope it should be diagnosed with.
Yes. Yes.
Yeah, I'm not an expert in that area. Now, and she's given drugs, and she has been actually giving the child the drugs for a period of like 3 to 4 days.
Yes.
And she has not witnessed any change. And again, she walks to another place and get medication again. She comes and tries this for some time. And you find she keeps on moving from one chemist to another, from one hospital to another. And is it as a result of the child's body being resistant to the drugs? In that case, what can you advise?
Yes, so I want to believe that as at Oasis Doctors Plaza Migori, our diagnostic system is very comprehensive. So when we make a conclusion that this is the diagnosis, then that is it. We try as much as possible to be very comprehensive so that we don't have errors. So all the question you are asking is related to error. Maybe a child has been diagnosed wrongly, and therefore, even if you give the drug, it is not helping. So that's why we are discouraging parents from buying the drug over the counter. Just bring the child to the hospital, we will subject the sample to the laboratory for testing. Once the result is out, then we treat based on the result which we have confirmed. Yes.
But have you kind of come across such issues?
At
Like
Oasis,
somebody walks in and say, my child has been sick and I took him or her to this and this hospital, they gave me these drugs, I've tried using these drugs, I'm not seeing any change,
Yes.
I'm here. Have you witnessed such cases?
Yes, we have observed.
In a place of such cases, what advice do you give?
We have observed several cases of that. A patient comes in, a mother comes in with a child and says that we have been treating this child with this from another facility and we are not noticing any change. So as we do, we take the clinical history of the child. From there, the clinical history and the assessment will inform us on which kind of test we need to run for this child. And at the end of it, we get the final diagnosis, and that is what we manage. In most cases, sometimes we get that the diagnosis we are making is maybe different from what the child was diagnosed with earlier at the peripheral facility where he was treated before. Or sometimes they're similar, but the kind of treatment which was given was totally different. Yes.
Now, I don't know whether you want to add something on what you're saying before I ask the next question, which is almost bringing us to the end.
Okay, just proceed.
Okay. Now, we want to talk about breastfeeding.
Yes.
And you find that to date in the society today,
Yes.
many women, they don't want to exercise exclusive breastfeeding. And what is exclusive breastfeeding? To what period?
Yes.
At what time is a child supposed to be introduced to, let me call it weaning?
Yes.
Yes.
Oh, thank you. So I think what is causing, what is now bringing the problem when we come about, when we talk about the breastfeeding, is about the lifestyle we live today. A mother deliver today, and in 2 weeks he leaves the child with a nanny at home. So when they go back in the evening, they feel like they are tired. They don't want to see the child. So the child is used to the nanny more than the mother. But that should not be the case. The exclusive breastfeeding is supposed to be from the time the child is born to the 6th month, the end of 6 months old. So once the child has attained 6 months of age, then you need to introduce now, do what you are calling the weaning off. So now you introduce other feeds. So this way now you can bring milk, because the milk from the mother has everything. It has all nutrients which this child require to grow for the first 6 months. It has water, so nothing you should give this baby at all from the other than the breast milk. But 6 months, after 6 months, then you can introduce the child to other feeds. But again, what is killing this is, as I said earlier, is that people tend to be too much into the profession than the child. So because of work, so I think it's a debate which is still going on even nationally, that how much time do we need to give a mother when we talk of maternity leave. Is 3 months enough? Because you will find that most of these children are weaned off when the mother is coming back to work. And at that time, they are not yet attained the month of weaning up, which is 6 months. So they tend to wean them off earlier than expected. So it is a debate which is still going on by the stakeholders, the Kenya Labour Law Society, and the national government, so that is it high time now we increase the maternity leave from 3 months to 6 months, so that our babies can have proper exclusive breastfeeding.
Now, in a case whereby a child is not breastfed the way he or she is supposed to, now, does it have any medical implications?
Yes,
medical
it does. Because when you subject a child to these other meals early than usual, then you are causing more harm to the child. Maybe the digestive system of the child at 3 months is not yet used to, or is not yet developed to external this normal feed we use. Yeah. So when you subject a child now to such kind of meals, porridge, tea, milk, then you are causing a lot of problem to the child. The digestion may not take place, metabolism may be compromised in the child. So this is a child who may end up being malnourished. And so when a child is malnourished, then there is delay in the growth of this child. Yes.
I want to say thank you so much, but before I bring this to a close, what is your perception of the idea of parents not having humble time with their children? Today we see everybody is preoccupied with work, they don't have time for their children, and the children find it so difficult to bond with the parents as they grow up. What is your take on it?
Thank you. I think parents need to choose. If you have chosen to be a parent, then choose to be a parent and do parenting. So if you don't want to be a parent, then stop giving birth and you concentrate on your work. But the moment you conceive, you carry the baby for 9 months, you deliver, then ensure that at any given time you are there for this child. For the child to grow normally, for the child to have that bond between you and her and him. Yes. So we need to draw line between profession and parenting. And that's why I'm telling you that there is a debate which is still going on that should we increase the maternity leave from 9 months, from 3 months to 6 months, so that mothers can have humble time with their children, especially during breastfeeding. And when we talk about parenting of these children, it's not all about mothers alone. The father is also there. You as a father, are you there for your child? Do you encourage the mother to keep on breastfeeding the child until 6 months? Do you offer the necessities? Yes.
Now, looking at that camera, what would you like to say to the residents of Migori, the whole nation, and people watching us all over the world regarding health of children, health of babies that we have in our homes, in whichever place that we relate with them?
Thank you so much. To the resident of Migori, to Kenyans who are watching, I would like to welcome you to Oasis Doctors Plaza Migori. We are here for you. Without you, we would have not been in existence. And therefore, you need to come. If you have any health issues, be it concerning children, adult, just come to us and we will sort you out. We have consultants who are resident, they're with us here. We have radiology department, we have theater which is operational. So anything to do with health, just come to Oasis Doctors Plaza Migori. We work 24 hours and we will attend to you. Oasis Doctors Plaza Migori is located at Family Bank building. So we are in first floor, second floor, fourth floor and fifth floor. So the hospital is located along Migori Sirare Highway. You can also reach us through the phone number 07 17 89 32 37. So this number, if you call, it goes directly to the customer care. We also have second number, which is 0790 642 551. This one you call, it goes directly to the nurse coverage. Thank you.
I want to say thank you so much. For the interest of time, we have to bring this to the end.
Yes.
My dear viewers, thank you so much for keeping tuned to BTV Kenya. Thank you for the comments. Thank you for letting us know where you are viewing us from. I hope me and you, we've had a wonderful time here with Mr. Peter Jombo.
Yes.
I hope I pronounced that well. And we believe at least you've got an insight on how you are supposed to relate and live with your child when it comes to health matters. Thank you so much. Until next time, we will have ample time to discuss more and get more information. God bless you and have a wonderful evening.
Thank you.
Asante.